After 30 years as a primary care doctor, mostly in an academic medical center setting in Philadelphia, I've had an epiphany, a realization that to fix the system, it's not about me, it's not about an office visit, it's about something we've come to call population health. It actually is it takes a village. Second, the public health community, wonderful group, they track improvements in health, but they don't actually deliver services. Providers like me, we deliver health care services, but we don't do it in a population health setting or in a population health basis. Finally, as was mentioned, I have the privilege of being part of the Humana family, working with them in the last 8 years on something they have come to call the bold goal. And this bold goal means that in every major market, we're going to try to improve the health of the population 20%, a measurable 20% by 2020. So these three things, my realization about population health, the fact that the public health community isn't really participating in this process, and the amazing work of the bold goal is what I'd like to talk to you about this morning. We're going to do this in three parts. First, a little bit of review. How do we get in this jam, and what are the tools and measures that might get us out of it? Where we're going with the bold goal in three different marketplaces. And then I'm going to issue a challenge to everybody in this audience. So this is a pretty sophisticated group. You're all healthcare experts in one way or another, and you've all been patients or will be. So you know that we're spending an awful lot on healthcare in our country. 18% of the GDP, $3 trillion a year. If the healthcare industry seceded from the union, unlikely event, it would be the fifth largest GDP in the world. We're doing this at an increasing rate, nearly 5.5%, 6% per year. By 2020, everybody in this room, including your children, spouses, each of us will be spending $12,500 a year on healthcare. Well, what does that get us? Well, regrettably, colleagues, we're number 17 in the world by any available research reproducible measure with regard to the quality of our life and the value for this $3 trillion investment. This is an untenable situation. With regard to our elders, and in our context here today, everybody over 65, a very large and diverse group, what do we know? Well, with regard to the elder population, nearly 10% of them live at the poverty level nationwide. Nearly a quarter suffer from some kind of behavioral health disorder, depression, loneliness. We'll come back to that. Pretty amazingly, with regard to the Humana Medicare Advantage population, nearly a third have a chronic illness like diabetes, socially connected to obesity, lack of physical exercise, poor nutrition, an incredibly complex problem. The good news is we have an evolving tool that helps us to actually measure that 20% by 2020, and it's free, and it's been around for 20 years. And this is something called Healthy Days, created by the Centers for Disease Control in Atlanta. This amazing 4-question tool, which has been reproduced and is research viable, says that we can measure the quality of our life with these 4 questions. 2 are focused on our physical well-being, 2 are focused on our mental health well-being. And this amazing tool enables us to answer the question, are we really improving health in a particular population? So there's physical healthy days and mental health healthy days or lack thereof. So, why is measuring healthy days important? Why would we care? Well, the tactical reality is, as a primary care doctor, I only need to know 2 things about you to predict your lifespan. It's not your cholesterol level, not your blood pressure, it's your zip code and your credit score. Your zip code and your credit score. And for all the businessmen and the women in the audience, wow. So why would we care about this, and how can we apply it to the problems at hand? So here's the truth. We've got it upside down, backwards, and inside out. Of that $3 trillion, we spend the vast majority of it on medical services, seeing guys like me, getting tests and procedures. There are 5 medical schools in Philadelphia, 2 of which are walking distance from one another. Healthcare is our biggest business. So, despite spending that 88% on medical services, we only spend 4% of the $3 trillion on healthy behavior, and the rest on a variety of activities. So we need to take this upside down and backwards crazy system where most of the spending doesn't have a return on a healthy investment, and we need to change it. We need to ask the question, what makes us healthy? Is it going to the doctor? Well, as it turns out, most of what makes us healthy is our own behavior. I won't ask you what you had for breakfast at the buffet this morning, but most of it is individual behavior. 20% is our environment, that zip code again, very important. 20% is if you're lucky enough to choose your parents wisely, that's important. And the rest is access to care. So once again, to tackle getting a 20% improvement by 2020, it turns out it's not about the delivery of services, it's all about these other social issues, healthy behavior, where we live, and all the rest. So, instead of focusing on clinical problems like blood pressure and coronary disease, to really achieve the bold goal, 20% by 2020, I'm going to focus with you this morning on 3 non-clinical, what we call social determinant issues. And these issues will tackle depression, loneliness and isolation, and we'll end with something really serious, food insecurity. So let's start with depression. What do we know? Well, in spite of the inspirational talks you heard this morning, there are some challenges. 1 out of 22 older Americans have clinical depression. We also know that this chronic illness that the elderly have, diabetes, cancer, heart disease, Parkinson's, and the like, can add to depression, and depression can exacerbate these conditions as well. And finally, these individuals report nearly 22 days a month on that CDC tool again as being mentally unhealthy. So what can we do to tackle this problem? Well, in New Orleans, for example, we're going to screen you in the primary care doctor office, like my office, and we're going to check to see if you're depressed. And if you are, we're going to have a rapid referral using this amazing digital platform company called Quartet in this particular market. We might be able to get you a behavioral therapist embedded in the primary care office, online, on the phone, over the telephone. We're going to make a rapid referral. Now, is rapid referral the only answer to this problem? No, but we've got a randomized controlled trial underway in New Orleans to test this theory. So rapid referral to a behavioral therapist. Second problem, loneliness and social isolation. Well, for families that don't have the resources, turning 70, 75, 80, spouses are dead, children are gone. The elderly, it's a 15% on average nationwide number of self-reported severe loneliness and social isolation. Not only that, it contributes to other chronic illnesses like diabetes, and despite spending billions of dollars to fix this problem, we haven't made a lot of progress. It's also true that loneliness and social isolation compound the depression. And amazingly, most especially following the previous presentation, loneliness and social isolation double your risk of Alzheimer's type dementia. Yikes. So how do you tackle a problem like loneliness and social isolation? Well, one of the ways is we've got to measure once again. We have to do what's come to be called predictive analytics. So in one zip code, it turns out there's so much crime and violence that the elders don't go outside to get any exercise, worsening their social isolation. In another zip code, it turns out there's no senior center. They don't have a place to go. They stay indoors as a result, exacerbating the social isolation. So Humana has some amazing both in-person and online technology. We're going to bring a care manager. We're either going to do it over the phone, we're going to visit these persons. And in certain zip codes, using this predictive analytic tool, we're going to take a van, we're going to pick them up, and we're going to bring them to an appropriate senior center. This is not senior daycare. This is the therapy for loneliness and social isolation, and appropriate programming that goes with it. So this is another part of how we're tackling these social determinants, as they've come to be called, for health. So finally, and probably most regrettably, is food insecurity. So in my 30 years as a primary care doctor, mea culpa, I have never once asked a family or family members, do you have trouble putting food on the table? Do you trade off paying the rent for good nutrition? It turns out this is a gigantic problem in the richest country in the world. 1 in 8 Americans over 65 suffer from daily food insecurity. This also means, despite spending billions, we really haven't made as much progress as we would like, a very important social problem. As a result, going back to that CDC tool, these food insecure individuals report twice as many unhealthy days, both physical and mental, every month. So how do you get your arms around food insecurity? Well, in the Florida marketplace, in conjunction with a wonderful social agency called Feed South Florida, primary care doctors like me, we're writing a prescription for healthy food. And it's subsidized at the local farmers market, at the grocery store. We're partnering with local farmers. We're trying to find a way to deliver healthy food at a deep discount, and we're also providing nutritional counseling. So look, here's the challenge. When you build your next facility, wherever it is, I want you to join me on the journey. I want you to find the local organizations, build trust, participate with these groups, promote healthy behavior, because as we promote individual healthy behavior and we aggregate that, you're going to promote healthy behavior for the entire community. Here's the punchline. I'm confident that we can achieve the bold goal in many more marketplaces with your help. The question remains, are you ready to join me to improve health in a measurable way, 20% by 2020? Thank you very much.